Eating disorders are not just about weight. People with eating disorders experience severe disturbance in their eating behavior as well as their thoughts and feelings related to eating. The main features of anorexia nervosa are a significantly low body weight, a severe disturbance in the way somebody sees their body, an intense fear of gaining weight, and a lack of seriousness about the disorder. People with bulimia nervosa are not necessarily underweight, but these people engage in binge eating behaviors and then compensatory behaviors to make up for what they've eaten. So it may be self-induced vomiting, use of laxatives, or excessive exercise. People with binge eating disorder also engage in binge eating, but they don't engage in the compensatory behaviors. So while we all may engage in overeating at times and even emotional eating, binge eating is defined as an objectively large amount of food, so an amount that most people would consider large, in a short period of time, so typically within a 2-hour block, and feeling out of control of their eating, so as if they can't stop. It's also associated with eating rapidly, eating until you're uncomfortably full, eating when you're not physically hungry, eating alone because you're embarrassed about the amount that you're eating, and feeling depressed, disgusted, or guilty after engaging in the binge. Obesity is actually a medical condition as opposed to an eating disorder. It is a chronic disease that occurs when an increase in body fat leads to metabolic and psychological conditions. Now, 60% of Americans are overweight and 35% are obese. And we often see binge eating behaviors in those who are overweight and obese. So while we treat this medical condition often with medications and bariatric surgery, it's also important to treat the underlying psychological problems so that they don't reappear later. Diagnosable eating disorders such as anorexia nervosa, bulimia nervosa, tend to occur in about 1 to 3% of our population. However, so many people go undetected because they never come in for treatment, and we don't know how many people actually suffer from the disorder. Even more importantly, so many people have subclinical eating disorders, which means they may not meet the diagnostic criteria for anorexia nervosa or bulimia nervosa, but they're really suffering with their eating behaviors and related thoughts and feelings, and they too need help. Anorexia nervosa is the third most chronic condition among young people, right after type 1 diabetes and asthma. Eating disorders occur in both males and females, across ethnicities, and across various ages. So unlike what some people think, we do see eating disorders in kids younger than 12 and also in adults over 50. About 50% of kids aged 9 to 11 have reported being on a diet, and 50% of college females report doing unhealthy behaviors to try to manage their weight. So this could be anything from using laxatives, skipping meals, vomiting, and smoking.